top of the morning, Lad Dental Nation. Switching it up a little bit this morning and trying a live video. Haven't done one of these since we partnered with the JAG program in Wabash and did some stuff with that program. And wanted to hop on here and answer any questions, see how we could be a resource for you guys, and also want to just bounce back some ideas. So see previous videos, we've talked about this a little bit, but Brian Kalea at the Dykema Group, a really big DSO law firm. They do a ton of transactional work and are kind of the gold standard in terms of legal DSO compliance, regulatory setups, all of that stuff. So highly recommend them. We've used them in the past and had a really positive experience. So wanted to talk about both Brian Kalea and Dr. Mark Costas, who for you guys at home is the Dentalpreneur. He has really good online content as well. Both of those industry gurus have predicted that 80% of the dental market will be DSOs within the next 10 to 15 years. Currently, that number is about 25% of the market. It's hard to really know what that is because the market is still so fragmented. Having true data is still a little hard to come by, to be honest. But in their opinion, 80% of this market, so they're predicting massive market consolidation over these next 10 years. And I tend to agree with their predictions. When we look at just the natural margin compression in this space, still the labor dynamics are incredibly difficult in almost every single position in the dental office. For instance, we are needing to get a couple more dental stools and assistant chairs. So not the doctor operatory chairs that we took a video about yesterday, but just the dental stools and the assistant stools. You're spending $5,000 to $10,000 just blinking, and those things will last a couple years. It's just fascinating to me to see the price inflation on all of the things that we buy and we have to have. So what their prediction is, or what they're saying is, just like the hospital network and the doctor networks, only 20% of that space is private because you don't have the bandwidth to do it all, to run the business, to do all the HR functions, to do the facility maintenance, to make sure you're regulatory compliant, to keep up with all of the complexities on a day-to-day basis, and be dedicated to 40 hours of gold standard of patient care is impossible to do. And now with the margin compression, it doesn't really even make sense to do it. I think the easiest example to hit on, and what has caused a lot of disruption, is just the hygiene debate kind of going on. There's still about a 40% nationwide shortage of hygienists. So with that, obviously wages continue to go north. Well, when you can control your prices like most businesses, that's not an issue. Here in the dental space, we do a lot of insurance contracted work. We don't control our fees when we contract with insurance. So as wages continue to go north, but our reimbursement stays flat, somebody is taking that loss. So as hygiene continues to become less and less profitable, it really doesn't make it worthwhile to the difference of being the associate versus the owner, I think, is going to continue to that gap is going to continue to narrow. And eventually, unless you're running just an unbelievably lean business, I honestly think the associate dentist is going to make more money taking it off the top on a percentage of collections than they will scooping it up at the bottom, having it to be profit. We have just seen massive, not only wage inflation, but just fixed expenses going up. I mean, our energy costs are going up, our business insurance is going up, property taxes always go up. I mean, all of these things continue to trickle. And again, remember, our reimbursement rates are flat, and they have been since the 90s. We have looked for efficiencies. Efficiencies are your only way to stay in front of this margin compression. We use Overjet, which is awesome. We use Dental Robot, which is awesome. So we are incorporating AI, but there's still only so much pull through that you're getting through with that AI right now. So comment down below. I'm going to try and do more and more of these live videos. I haven't seen any comments come in, unfortunately, yet, but as they do, really want to talk about and have this just be an open, transparent platform for both dentists and patients. Again, I think it's interesting for patients to be educated on some of this stuff, so when they go into the office, they can understand why some of these things are priced this way. As you guys know, at home, I sold spinal implants for 5 years before I pivoted over here to Lad Dental Group. So just having the patient understanding, I think, is a cool prism to look through as you're walking into your dental office or things of that nature. So again, comment down below. We're going to be doing more and more of these live videos if you guys like this content. So stay tuned for more. Hope you guys have a wonderful Friday Eve on this December, and stay warm, guys, because it's chilly here in Indiana. Cheers.